Hello, I'm Dr. Borel, Dermatopathologist with a private non-hospital-based office laboratory practice in Topeka, Kansas. I wanted to introduce myself to you today, and thank you so much for coming to my website to introduce yourself to my practice. You know, in 1996 we established our practice in this location, and we have a logo that's as you can see here, and we have a practice philosophy on our presentation brochure that we established at that time. It says, dedicated to serving the physician's office. And that's been our main goal when we established this practice back in 1996, and it's something we kind of look at each day when we come to work, and it's what drives us and motivates us each day. Our practice is a non-hospital based practice. It's a private physician's office, and as such we think we understand the issues and the problems that each of our clients pretty much face every day. Even though we don't see patients here, we see biopsies of patients, so to speak, but that come from living patients that are so important to each of us here. We know that we have some very similar problems that our referring physicians have, dealing with managed care, getting into those networks. And so everything that we do here is designed to make our interactions, or should I say your interactions, with our dermatopathology laboratory as easy and as simple and as efficient as possible. We have a great deal of respect for our clinical colleagues and the work that they do, and we want to make their interactions with us as pleasant and as easy as possible, because we want them to be able to focus their attentions on the patient care process, and we want our part of that to contribute as positively as possible to that end. So that's what we do. We dedicate ourselves to making sure that our part in that process is as functional and as helpful as possible. And since we don't have divided loyalties, we don't for the most part serve hospitals. We certainly are not hospital based. I do cover some outlying hospitals and do receive specimens from those hospitals that we examine here, but I'm not hospital based, and I don't have all the competing responsibilities that are very important, and I know how important that is, because I used to be hospital-based for a good deal of my career, and I respect hospital-based pathologists greatly in what they do for the patient care process. But in this practice, I know that I don't have those kind of responsibilities, and so I can devote myself exclusively to dealing one-on-one with my referring physician. So that's kind of another thing that differentiates my practice currently from some of the other dermatopathology practices that you may deal with. I'm in solo practice at this time, and it may not always be that way. My practice may get considerably larger, and then I'll have a colleague to join me, or perhaps more. But for now, I'm in solo practice, and so when you send me a specimen, you know that I'm going to be reading all of them, and you can always talk to the person who read the slide is myself. So you get, if nothing else, you get continuity every time. It's the same person reading your slide, and you can have a personal relationship with that person. You can call my cell phone at any time. It's on my business card that I make available to my referring physicians, and I encourage your calls. I greatly appreciate receiving them and talking to my referring physicians and hearing how they're doing and how their practice is doing and how their staff is doing and their families. I consider my clinical colleagues to be a part of my extended family, and their well-being is so important to me. And if I can contribute in some small way to enhancing their lives and their practices, that means a great deal to me. So for those of you who are calling me, I greatly appreciate hearing from you, and hope you're all doing well. And I look forward to adding new members to that family as as my practice grows larger. So thank you so much for visiting with me today, and I look forward to speaking to all of you in the future.